Hi, I'm Dan Sosnoski, Editor-in-Chief of Chiropractic Economics Magazine. We're here at Parker Seminars Las Vegas 2018, and it's my pleasure to have with us here Joe Kenrick. He's the Central Regional Sales Manager of Cutting Edge Lasers. Joe, I'd like to just ask you, why laser? We hear the term photobiomodulation therapy. Let's demystify for that. Well, what is going on with that, and how does a Class 4 laser activate that?
Yeah, so we all know that plants absorb sunlight, right, and turn that into food, turn it into energy. At the same time, humans go outside, they attract vitamin D from the sun, right? So we already know that lasers, light equals energy. It's just a matter of how we turn that energy into something the body can use, right? So Class 4 lasers, all lasers come in different classes, and as you go up the spectrum, they become a little bit more powerful and they become medical lasers to create medical benefit. So a Class 4 laser actually allows the body to, the laser energy stimulates the body, goes through a process of taking away inflammation from the body by vasodilation. We're able to increase blood flow, which means we're able to bring more oxygen and food loads to the body. Class 4 lasers also are able to stop the pain signals from the nociceptors to the brain, releasing endorphins and enkephalins, so the patient feels less pain and feels better. But the most important thing is we're actually able to stimulate the mitochondria to increase ATP production. And that is the energy the body needs to start the healing process. Okay?
So damaged tissues are sort of in trouble, and with an injection of energy, they're sort of stimulated to given the nutrients they need to start...
Exactly, heal itself.
Gotcha.
Yep.
Okay. And how compatible is laser with chiro? That is, if a doctor is having sort of a traditional chiropractic practice, and all of a sudden he brings in this laser machine,
right?
How does he make that work for the patient? That this is still a holistic, natural...
So a couple of things. One is today chiropractors see a percentage of the population who come in for adjustments or massage or some of the other offerings, right? But at the end of the day, whether it's a chiropractor or any other medical professional, they have a percentage of patients they just can't help, right? So laser does a couple things. It allows them to supplement their treatment protocols with laser to help speed the process along. The other thing that happens is there's a portion of the population that is looking for a solution that the insurance way of treating people hasn't worked, right? So people have gone to PT, they've gotten shots, they've gone to surgery, yet they're still in pain, right? So chiropractors have understood that if they bring in laser technology, they can actually go after the larger population and offer services to help them that may not be tied to chiropractic, but because they understand lasers more than a lot of medical professionals, they're well versed in lasers, they're able to bring that technology in and offer it to a larger community.
That's an excellent example, or explanation for that.
Thank you.
I recall a case, I think my wife was suffering from a plantar fasciitis, and she looked for a chiropractor who had a laser treatment because she knew that would work. She wasn't interested in getting adjustments, she wanted the laser therapy. So it could bring in a patient base that you might not already be seeing, and as you said, it might augment treatments that you're already providing.
Right, exactly.
Just top line, just off the top of your head, some of the major conditions that you can address with the therapeutic laser?
So everything a chiropractor sees today, right? Lumbar pain, sciatica, cervical issues, shoulder issues, all of those are conditions that you would treat with a laser. Add that, knee pain, like you said, plantar fasciitis. You're usually not doing an adjustment to heal plantar fasciitis, but Achilles tendonitis, plantar fasciitis, all of those. And interestingly enough, now chiropractors are using lasers to treat neuropathy. Right? That patient population has pretty much been left aside because nobody has a good solution. Lasers now give you a new solution, and we've had great results with lasers treating neuropathy.
That's right. We cover neuropathy clinics or neuropathy niche practices in the magazine. using all the time, and normally speaking, laser is mentioned as one of the key technologies that they use. If there's a lot of products on the market, there's a lot of choices that can be made. Without going into super detail, what are a few of the kind of top line features that a DC should be looking for when they're evaluating a laser for their practice?
Yep. So first thing they want to know is efficacy, right? Because a patient's not going to spend money or work with you long term if you're not getting results.
Right.
So you want to have efficacy. And so when we see those, when we're looking at lasers, we're looking typically at class 3, class 4 to get that type of efficacy.
Yeah.
Right? The higher you go, the greater the efficacy. The other thing that doctors have to look at is, how busy am I as a practitioner already with my patients? And if I bring a laser, how do I fit that in, right? Well, some of the lasers actually, like ours, will treat a patient in an unattended manner. So now a doctor can actually duplicate their time and effort because the laser's treating in one room and they're treating a patient or making an adjustment in another room.
Gotcha.
So to do that, you want to make sure that there's no risk of thermal damage and that the patient will be safe, right? Or you're looking for a delegatable laser technology where the doctor doesn't have to be the one doing the treatment, right? That he could delegate it to a staff. So if he's delegating to a staff, he has to factor in that cost. Otherwise, a completely unattended laser saves the employee costs and still gets some of his results, right?
Interesting answers, good points.
Yeah.
Well, okay. Well, hey, Joe, thanks for talking with me so much.
I appreciate your time.
Very informative.
Thank you much.
Thank you.
Have a good day.